Why is confined placental mosaicism important for chorionic villus sampling decisions? Imagine you're trying to understand your baby's health before birth, but the test results might tell you one thing while the actual situation is different. That's where confined placental mosaicism comes into play. When doctors perform a chorionic villus sampling, they take a small piece of placental tissue to check for genetic issues. Usually, the genetic makeup of the placenta matches the baby, but sometimes it doesn't. About 1–2% of pregnancies have this condition, where the placenta has a mix of normal and abnormal cells, but the baby is healthy. This is called confined placental mosaicism. This condition is important because it can cause confusing test results. If the CVS shows a genetic abnormality, families might think their baby has a problem. But with confined placental mosaicism, the abnormal cells are only in the placenta, not in the baby. So, the test might suggest an issue when there isn't one. To be sure, doctors often recommend a follow-up test called amniocentesis. This test samples the amniotic fluid around the baby and gives a clearer picture of the baby's actual genetic health. The type of chromosome involved in confined placental mosaicism also matters. Some chromosomes, when affected, can cause problems like slow growth or early birth. Others, especially sex chromosomes, usually don't cause issues. For example, if the mosaicism involves the sex chromosomes, the chances of affecting the baby's development are low. But if it involves chromosomes linked to serious conditions, the situation might need closer monitoring. For families considering CVS, understanding confined placental mosaicism is key. It's a known limitation of the test that a positive or unclear result might not mean the baby is affected. Knowing this helps families prepare for what follow-up testing might be needed. It also reduces unnecessary worry and helps them make better decisions. When CPM is suspected after CVS, doctors may suggest more testing and counseling. This step helps families understand their options and plan their next steps. Explaining the possibility of CPM clearly can make families feel more confident and less anxious about the process. In short, confined placental mosaicism is important because it shows that a genetic abnormality found in the placenta may not be in the baby. Recognizing this helps families get accurate information, avoid unnecessary stress, and make informed choices about their pregnancy. It highlights why follow-up testing is often necessary after CVS to get the full picture of the baby's health.